I'm ready. Ready to go. Good morning, and welcome to the first Guardian Recovery Network Symposium. My name is Tommy McGee. I'm the National Clinical Director for the Guardian Recovery Network here at location at the Immersion Recovery Center in Delray Beach, Florida. So I just want to introduce you to our team and talk a little bit about why we decided to put on the symposium in the first place. The purpose began with we wanted to offer something to our clients and the population at large, whether that be our former clients or current clients. We wanted to put something in the therapeutic or clinical space that our clients could better connect with the clinicians that we have here on staff. We thought, what better way to do that than to showcase some of our clinicians and their skill sets so that their clients, again, former or present clients, would have an idea of just how special the clinicians we have here on staff are. Because part of the reason that, I appreciate working at the Immersion Recovery Center, the Guardian Recovery Network, is because of the energy that I feel in this place. I know for a fact that the staff that we have here have their hearts invested in this process. And we have a unique process, a somewhat, I won't say difficult process, but somewhat complex process. We have a process where we've prided ourselves on being able to integrate 12-step programming with true evidence-based clinical technique. Kenny Silver, my colleague, will talk a little bit about that whole process a little bit later today. But again, we've taken pride in being able to integrate these two special disciplines in a way that we feel is most effective with the clients that we work with. So again, part of the purpose was to put something in the stream, so to speak, the therapeutic stream that our clients would be able to identify with and take some pride in, and also be able to benefit from some of the coping mechanisms that we're going to talk about during this 3-day symposium. Another purpose, we wanted to open the dialogue on this whole subject of hope. I believe that hope is a lofty word, that it carries a lot of meaning. And I also know for a fact that the people that are in this community benefit from the inception of hope into their lives. And so what we want to be able to do is we want to be able to not only show technique, but again, we want to talk about the heart and energy that is a part of this place and something that emanates from the people that will be doing these presentations. And I think the most powerful thing that many of our facilitators have is their ability to convey this sense of hope. So part of our symposium, you will be able to see, and I encourage you to plug in, take it into your private space and learn something more about how we ensure that the people that we assist are able to garner some hope from us. For our staff, the purpose is I wanted to appreciate the skill sets of some of our staff members. I want to give them their roses while they're here. I want to talk and brag about this team that I'm proud to be a part of. Our support staff, the strength that they have and the work that they do with our clients. I wanted to give them the opportunity to see the benefit it is of having some skills that we're going to teach here in the symposium. I also wanted the therapists to have an opportunity for the rest of this recovering community to see just how talented they are and to benefit from some of the skills that they've learned and education that they have and that they've gained over the years. So I wanted to share some of my experience as well as the experience of my team with the community at large, which includes that therapeutic community. Because again, I'm proud to be a member of this team. I've 23 years of experience in the field of recovery and substance abuse, and I'll say sincerely that this is the most talented and heartfelt team I've ever been a part of. So I am truly blessed to be a part of this team. So I wanted to give you an opportunity to plug into the energy that I feel in this team, these strong people that I've had the opportunity to be a part of. Also, I wanted to create some unity amongst our ranks. I wanted our executives again, our therapists, not only at this location, but at the other locations within the Guardian Recovery Network, to have a chance to see their peers do their thing, so to speak. To see them talk about some of their strengths, to be able to watch them practice some of the skills and talk about those skills. So I believe that long as we know the strength that exists within our team, we can find pride within that team. So I wanted this symposium to be an opportunity for us to appreciate each other and have gratitude for being a part of this particular team. So I wanted to create some unity. As it relates to our partners, those others programs that work in this space, I wanted them to also be able to find some inspiration and motivation. I mean, I know what it feels like to go out to a workshop, to work on some new skills, come back from that workshop, and can't wait to practice those skills in this space of help. So I wanted the people in our community, whether it be our sober living community, sober residence community, or some of the other treatment centers that we partner with, some detoxes, other entities that are also looking to help. I wanted them to have an opportunity to be inspired and motivated by the energies that I believe emanate from this place. Again, I think that the Immersion Recovery Center in particular, but all the centers operating within the Guardian Recovery Network, emanate this sense of peace and spirituality. At least that's been my experience. My experience coming from a place where that did not necessarily exist, to find a place where I could actually not just practice my skills, but be fed by people that also live a spiritual lifestyle. So that's something that I wanted to offer to our partners as well. And to our community. A lot of people are not familiar with the work that happens in substance abuse treatment. They know about us, what they've heard about us on MSNBC or American Greed, or what they've read about us in the paper, what they've seen on the block, so to speak. They don't necessarily know who we are. So my hopes was that people outside of this immediate therapeutic community, this substance abuse community, these particular treatment entities, that other members of the community that had an opportunity to tune in, that I shared the links with, that they would have a chance to see exactly what we're about, and to see how we go about trying to treat the people that often are the castaways within these communities, how we treat them with love and care, and how we believe that treatment brings about change. Unfortunately, we will not have any testimonies within the symposium, but my hope is that as you watch the helpers practice their craft, that you will be able to get from them that feeling that they transfer to the people that they're working with. So that is what I wanted to get for the community. I wanted you to see and have an opportunity to see just how much we care and how we transmit love to the people that we care for. Also, one of the strongest things for me is I wanted an opportunity to connect. I wanted to be able to reach out and share some of the energy that is a part of this place, some of the special people that are part of this place, some of the meditative practices that are a part of this place. And I felt that this format, that we would be able to reach several people that could share with us in this particular spiritual event. In my opinion, this is a spiritual event. So what I invited several of my colleagues to be a part of this symposium. Several colleagues that, again, I think are extremely special and I know are very talented. Immediately following this introduction, Kenny Silva will be giving you a snapshot of our clinical philosophy. So he will walk you through what we believe is effective in treating clients as well as their families. And so he will talk about that integration that I mentioned before, the clinical work that we do as well as the 12-step work that we do. And as important as I believe that message is, I think it's also important that you have some understanding what kind of young man Kenny Silver is. He's our executive director. He is very committed to his, I would just say he's very committed to the task at hand, because I don't get the feeling from him that he's committed necessarily to the position or title. I think that he is committed to the clients that he treats. He's extremely smart, talented, very efficient young man that I've had the opportunity, the privilege to be able to work with for a year or more. So I encourage you to pay attention to the message that he delivers, but also to try to garner something from the energy that he brings. One of our clinical supervisors, her name is Amanda, she will be talking to you about de-escalation techniques. Amanda is an extremely gifted clinical genius, in my opinion. And so she has a vast amount of experience in experiential treatment, psychodrama. I've seen her work with clients that were extremely challenging and be able to build rapport with those clients when many others had struggled with the same challenges. And so I, again, invite you to pay attention to our de-escalation presentation or facilitation of de-escalation skills, but to try to gain some knowledge and feel some of the energy that she brings when she teaches you these techniques. One of the therapists that we have, her name is Anna Barrett, and she'll be talking about 12-step versus CBT. Out in our industry, there is a lot of theory about the similarities between 12-step recovery, 12-step programming, and cognitive behavioral therapy. And what Anna will do, and Anna is, again, another one of our extremely talented therapists, one of my, I would say, spiritual mentors. What Anna will do is that she will put this in layman's language so that people can understand not just the theory behind those similarities, but actually be able to see what the similarities are between these two disciplines, between cognitive behavioral therapy and 12-step recovery program. Because in some people's eyes, those things are completely different. But again, there are those in our clinical space that believe there are some pretty strong similarities, and Anna will be able to point those similarities out to you. Our director of case management and also one of our therapists here, his name is John Post, young man, very strong in his clinical skills, has that ability to operate in both those positions and capacities and be extremely efficient at it. I would say very talented. I know for a fact he's a very talented therapist. He works with some challenging clients as well. Always assign him some clients that can be challenging. It's seldom, if ever, has turned away from those challenges. He will be talking to you about the power of language in substance abuse treatment. And the reason that we felt that that was an important topic is because there are some myths in regards to the treatment of substance abuse in this industry. There are some beliefs that are somewhat antiquated that have been brought into the field that we are in the process of modifying, but John is going to talk about the history of those methodologies as well as the trend in which the field is going in now. So again, he will talk about the power of language within substance abuse, but I would encourage you or ask that you listen to what he says about language, period. Because I think language is not only important as it relates to substance abuse treatment, but I believe that language is important as it relates to our daily connections, our interactions with other people. So again, I would invite you to take a listen to John as he talks about the power of language, and also appreciate the talent that will be before you. And then we will have Michael Herbert, who is an interventionist in the area, as well as a therapist and one of our strong group facilitators. And Michael will talk about family work, one of my favorites. You know, he'll talk about what we have, which is called Family Workshop. And Family Workshop is a 3-day event that we have once a month where we bring the families of the clients that we have in our programming, and they are exposed to groups as well as aftercare planning with Michael Herbert and Amanda. So they are sitting in groups 2 days with their identified client and a day alone where they have the privilege of being treated by Amanda and Michael. So Michael will explain the details as well as the philosophy behind the family workshop and structured family recovery, and also will share some of his vast experiences in travel and his own experiences with family work. And on our final day, we will have the opportunity to hear from our co-founder and CEO, Joshua Scott, who's also an interventionist in the community. And Josh is no doubt one of the most intuitive men that I've ever met. And I would say at this point, he is also one that I would consider a spiritual mentor of mine. He has a vast amount of compassion, an overabundance of compassion that I like to plug into. He has this belief that emanates from him that we can work with every client, something that I appreciate. And so Josh will talk with us about Guardian Recovery Network, its history, as well as its vision for the future. And so I'm looking forward to having him come in and talk with us about those aspects of our agency. So the question was for me, what are we trying to do here? What exactly is it that we're looking to accomplish here? And one of the answers for me is that I want to share some of my guardian heroes with some of my heroes that I've come in contact with on my journey in the field, on my journey into not just this position, but my journey into this spiritual space. I wanted to share with you some of the people that continue to hold that foundation intact for me. I thought that I would be beneficial to you for me to gift their talents to you again through this format. Also, I wanted to talk specifically about interventions. I thought that it was important that the community learn something about de-escalation techniques. I also wanted to put to rest add to the discussion about CBT versus 12 steps. I thought we would benefit from learning more about the language in the treatment program and that idea of unconditional positive regard. And I thought that John Post would be a good person to talk about that. And I also wanted to know more about treating co-occurring disorders. And Alexis Rossi, who is probably one of the most intelligent ladies I know, who works in our quality department, will be talking to us about identifying and treating co-occurring disorders. So I'm looking forward to that. Another thing that I thought was important was family work, because I believe that doing appropriate family work is the basic foundation for successful substance abuse treatment. We're also going to explore, we're going to talk about just the basics as it relates to boundaries and ethics, which I think is pretty important. One of the issues that I've encountered in training people coming into the field is a lack of understanding or how to follow the basics of ethical behavior, specifically boundaries. So we'll talk a little bit about that, and I thought that was important to put out in this space, especially for people in early recovery who have the aspirations to be involved in this field. That talking about the basic ethics and giving some education on that would be important. Also, I am a believer in self-care. I think that if our clinicians are frequently telling our clients about the importance of taking care of themselves, that it's also important that our clinicians know how to take care of themselves. So I'm going to talk a lot about vicarious trauma and burnout and how to avoid both. How to avoid vicarious trauma. Some would say that it's inevitable, and how to avoid. Some would say it's inevitable to have burnout, but how to treat it if you start to suffer with some of the symptoms, or if you start to be challenged by some of those symptoms. So the major takeaway that I would like for us to have through this symposium, first, I would like us to have connection. I would like us to have education, and then I would like us to explore and benefit from the energy that you feel from or see in the facilitators in all of our workshops. And so in about 30 minutes, again, you will have the opportunity or the privilege to hear our clinical philosophy from Kenny Silver. So I ask that you would stay tuned and tune in and plug in to Kenny Silver at 11:30. Thanks for joining us, and I look forward to speaking to you again soon.
Silver, I'm the Executive Director at Immersion Recovery Center. I'm going to touch on our clinical philosophy. We made our clinical philosophy, it's a joint effort between Tommy, our Clinical Director, Josh Scott, and Isaiah Goldman. And myself, we realized that we were lacking a uniformed message and document that could be a universal instrument for all of our treatment team to use. And I think the main goal of the document is to, have a backbone to our treatment team discussions, to our client handbook. This isn't a document that is for staff only. This is a document that can be reviewed with staff, that could be reviewed with clients, that can be reviewed with families, potential referring sources. This is a universal document, and I think it is best used when we have it as a part of our daily lives and our monthly lives and our meetings when we're discussing whether it be interventions or treatment recommendations or anything like that. I think that's when this document is best used. I don't know that this document is best used to myself. I think it's best used in as a conversational piece. So we're going to start off by what is addiction. Addicts suffer from the mental obsession to use drugs, alcohol, engage in other destructive behaviors. We define the obsession as recurrent, persistent thoughts that supersede and do not respond to reason. Without a program of recovery, an addict will always be on the losing end of an internal negotiation to make good decisions around their addictive behaviors. Untreated addiction is characterized by restlessness, irritability, and discontent, coupled with anxiety and frustration with the world at large. Abstinence alone is not recovery, as abstinence is the absence of a recovery program will inevitably lead back to active use. The primary physical symptom of addiction is an abnormal reaction to mind and mood-altering substances. We identify this as an allergy called the phenomenon of craving. This is an inward, overwhelming compulsion to use more substances once the first drug or drink is ingested. Very simply put, once I start, I cannot stop. Or once I start, I have very little control over what happens next. The phenomenon of craving is a distinct, pronounced physiological reaction to the first one that is entirely unique to those that suffer from addictive disease. This abnormal reaction to drugs and alcohol is terminal, meaning there is no known cure. A period of abstinence does not remove this physical trait, as addicts will find an inability to control their use even after a long period of sobriety. Addiction is a progressive disorder. Over any considerable period of time of active use, an addict's life will deteriorate rather than improve. Addiction progresses by changing the chemistry of the brain and increasingly compromises areas of the psychic apparatus that mediate choice, reason, accountability, and satisfaction. The brain ultimately becomes diseased and can no longer be relied upon to act in its own defense. Addiction generates and becomes a cycle of anger, depression, boredom, and anxiety, driving an addict to seek ease and comfort. An addict that has achieved abstinence may gravitate toward negative behaviors first before returning to active substance abuse. These behaviors often include gambling, unhealthy sexual behaviors, disordered eating, compulsive exercise and spending, as well as entering into volatile romantic relationships and excessively working. Invariably, an addict will return to drugs and alcohol, thereby triggering this phenomenon of craving. Addicts suffer significant internal and external consequences. Virtually all facets of an addict's life will become unmanageable as the relationship with drugs and alcohol become paramount to everything else. Unmanageability will also stem from decisions made by an addict at times of abstinence. We do not discount the wreckage that has been created by dry drunks. Most of our clients have considerable consequences in both their personal and professional lives. Mismanagement of money and financial ruin are the norm. Many clients have had legal issues and are facing serious consequences if they are not able to find recovery. Chronic use will lead to co-occurring and medical issues that are often serious and can be fatal if not addressed. Addiction and alcoholism is, like it says in this document, an inability to connect the way that I think, feel, and act with what I know in my heart makes the most sense. And as an addict is progressing through their life, they often feel as if my life is getting worse, and their family gets upset that their loved one is getting worse, and employers often feel as though my client's life is getting worse. And in all actuality, we externally that makes sense, but internally we see what's happening is that the client is moving further and further away from who and what they know they could really be, a desire to become who they really know they want to be, and what we identify as the truth. We believe alcoholism and addiction to be a trifold illness. Primary symptom is this allergic reaction. Addicts and alcoholics cannot safely use mind or mood altering substances without developing a naturally occurring event inside of me that will continuously demand more, whether we had signed up for it or not. While abstinent or away from this primary substance of choice or drug of choice, addicts suffer from a thought process that says we have a disease that says we don't have a disease. I fall victim to lies often as an addict that say that I can engage in destructive behaviors without destroying my life. And addicts believe that. We don't believe addicts make these poor decisions based on truths. I think they make these bad decisions based on lies. And this is this obsession that we speak of, which is this persistent, reoccurring thought that doesn't respond to what's actually true. We see clients engage in our treatment process all the time that will go down very similar paths that they might have went down prior to this or in other treatment episodes. And the client in the moment cannot see that what I'm about to do is the exact same thing that I've done the last 3, 4, 5 times. They believe that they can do it in success. From experience, we know that they are falling victim to this obsession. This persistent and reoccurring thought that doesn't respond to the last 3, 4, 5 times. It's simply going off of what these bad choices are going to do for me rather than to me, and the addict falls victim to this obsession of the mind, and they're off again. Recovery is possible. Addiction is a treatable disease of the mind, body, and spirit. Alcoholics and addicts can live free from the mental obsession to use, thereby eliminating the devastating consequences associated with taking the first one. Successful recovery is a lifelong process centered in total abstinence from mind or mood altering chemicals and ongoing application of spiritual practices. A strong foundation is built in treatment through rapid immersion into the 12 steps and active engagement in clinical features of our program. We do believe we can recover from alcoholism. It is going to be a daily practice, and we believe that with initial dependence on the immersion process and initial dependence off of the connection between client and staff, we can interrupt this destruction which has been presented by the phenomenon of craving. Once it's interrupted, we also know that it's not going to stay interrupted simply by the fact that it's arrested. In the moment of interruption is, we believe, to be the moment of opportunity. And at that point, utilizing clinical 12-step medical interventions, we look to expose what can prohibit change. We understand completely that if clients plan to leave the way that they came, they are going to leave the way that they came. The overall hope is that we leave a different person than we came, but we're never going to be able to change without, capturing the moment of opportunity that we would really only have in this initial period of abstinence. Who we are. We're a treatment team of clinicians, medical, psychiatric, and behavioral personnel, and experienced addiction professionals dedicated to a specific 12-step practice and methodology. A team approach to treatment is necessary for meeting our clients' physical, emotional, social, and spiritual needs. Our clinical staff has been trained in current interventions and modalities, recent information on the treatment of particular populations, and what has been effective in addressing co-occurring disorders. Our direct care 12-step personnel are practitioners of a defined 12-step model, as we believe consistency of message is critically important to the execution of the 12-step process. Immersion is a crucial integration of two modalities, bridging the gap between the best of traditional treatment program and long-term freedom promised in 12-step recovery. The combination of our clinical staff, 12-step staff, medical staff, and our support team, our support staff, provide a wraparound service to our clients at Immersion. Each staff is responsible for engaging in their role, contributing to this particular clinical philosophy. Clients are presented with a primary therapist, a 12-step contact, and a medical provider. Those are the three initial, direct care contacts that they have, and then all in the meantime supported by our support staff. What we do and how we do it. A spiritual experience is the ultimate goal of treatment and the recovery process. We define the spiritual experience as a change in personality sufficient to recover from addiction. The spiritual experience occurs through the treatment work required by the Immersion clinical program. This process begins with educating our clients on the disease model of addiction and related behaviors. A client must have clarity on the addicted on the addicted condition and how it influences their thoughts and actions. The next phase of the Immersion program is building resolve and motivation for the action required by the recovery process. This is followed by an intensive 2 to 4 week examination of what is blocking the spiritual experience. Most of our clients have had multiple treatment episodes and some historical periods of abstinence prior to entering our program. This process identifies the reasons an addict fails to enter into recovery, as well as contributing factors to relapse and disengagement from a recovery program. The addict suffers thought patterns, attitudes, and behaviors that prevent sobriety. Most of these thoughts center in anger, self-centered fear, and emotional consequences of the addict's personal conduct. Once these patterns are identified, it permits our client to embark on a journey to remove all that is quote-unquote broken in him or her. This journey involves re-entering into society as sober men and women and establishing purpose and usefulness. We are able to provide our clients with the complete skill set necessary to arrive at long-term recovery from active addiction through the last phase of the Immersion program. This is a 3-month commitment to practical application of the Immersion method in actual life and situations and challenges. 3 phases make up the Immersion experience. In our first phase, clients are educated and asked to acknowledge and identify certain barriers to this spiritual experience. And I'm just going to recap on that spiritual experience. Some sort of personality shift where I no longer have to be blinded about what that bad choice, what that bad relationship, what that first drink, what that first night out is going to do for me. I can clearly see at that point what it's going to do to me, right? If I can leave Immersion as a changed person, I don't need to fall victim to simply what these things are going to do for me. I understand what they do for me. I learn all about it in the first phase of our treatment program. Clients are asked to identify what these barriers between them and who they really want to be are. whether it be my inability to dodge the first drink, my inability to build enough esteem where I stop going back to abusive relationships, my inability to accept help if I've got a known eating disorder, my inability to remain med compliant. You know, we in the first phase of treatment, we initially task and we educate clients to acknowledge what might stand in between them and who it is that they really want to be. After that, we ask them to acknowledge what power these things might really have. We believe that if clients can acknowledge the severity of these barriers, they can ask themselves a very simple question: does it make enough sense for me to try to connect to the treatment team or not? If a client can say that they are willing to connect to the treatment team or not to help them accomplish what they've been unable to accomplish on their own and to help chip away at some of these barriers, we then ask them to make a choice. That choice would be to engage in your treatment plan. You know, that choice has to do with a daily initiative which calls for action, which calls for commitment, and which calls for a lot of self-sacrifice at that point. We firmly believe that if we're able to educate and help clients understand that they may suffer from an illness which is a bit more powerful than their desires to change, we hopefully can transmit enough hope for them to say, you know what, well, maybe with the help of you, I can change. That all takes place in the first phase of our treatment, lasting anywhere from 10 to 30 days, depending on how long it takes. Our second phase of treatment is a very clear-cut examination process, which helps us dig deep into whatever these barriers might be. We see clients often suffer from failure to launch issues, suffer from low self-esteem, suffer from mental illness, suffer from codependency, suffer from all sorts of things that again are in conjunction with their inability to control the amount they drink or use once they start. The second phase of our treatment is to, now that we've acknowledged the power that these things have in our lives, how can we possibly move our way through them? Our second phase of treatment is it's a surgical effort to really dissect and discover the truth about how these issues have essentially driven me to a place of self-destructiveness. After this exercise is complete, we believe that clients are seeing their life through a different lens. After this examination process is complete, we think that clients can see the one thing that they've been unable to see for years, and their family as well. And that one thing being the truth. You know, and the truth is that it might not be my abusive relationship with drugs and alcohol. You know, it might not be that in its entirety. There might be other things in my life that if I'm unable to accomplish, I might do the inevitable, which is going back to pick up a first drink. And if I understand the allergic reaction, if I go pick up a first drink, I'm not going to drink without developing this phenomenon of craving. And if I can't control the amount I take, this isn't going to end well. Once clients are ready for our third phase of treatment, which calls for a reintegration into society, the Immersion treatment team gets to manage a client's stress levels as they go into work while managing an intensive outpatient group schedule, which maybe meets 4 days a week for 3 hours a day, with managing meetings with your individual therapist, managing meetings with your sponsor, engaging in relationships, friendships, intimate relationships, whatever the case might be. In this pretty intensive 3-month commitment of phase 3, we get to watch clients do the one thing that they've never been able to do, which is stay sober. We think that, clients' freedom is proportional to their degree of discipline. And what we like to see is, how do clients do in the real world while trying to manage my life, the one thing that they've been unable to manage. And with the support of supportive housing, we're going to recommend sober living if applicable. And with the support of ongoing outpatient treatment, we support the client as they reintegrate into this management of responsibility while newly sober. That takes place over a 3-month period. Clinical objectives. Clients in the early phase of Immersion program will experience emotional dysregulation. Our clinicians are tasked with intervening in emotional and mental instability. Our counselors and social workers utilize evidence-based, clinically refined techniques to accomplish this. After a comprehensive assessment, a treatment plan is developed to address these client specific needs and challenges. Clinical work with a client to bring self-awareness is insufficient to affect change. Our therapists are responsible for creating objectives to move a client towards change. A client will continue to present behaviors throughout his or her time at Immersion that require ongoing assessment and intervention. A serious consequence of substance use disorders is a diseased and damaged brain. This result is an addict's inability to recognize the severity of his or her condition. We ask clients to be open-minded to the idea that they are significantly impaired. This impairment surfaces not only in active addiction, but as a client begins to improve physically and emotionally in early recovery. An attitude of quote-unquote, I got this, I don't need to follow through with the entire program, or outright defiance is not uncommon. Our clinical team is tasked with confronting resistance while motivating a client to build resolve and remain committed to the Immersion process. Groups are designed to create a stronger social bond amongst client and facilitate discussion on shared disorders and challenges. The objective is to encourage the vulnerability and intimacy necessary to begin a life of healthy and productive interpersonal relationships. Groups provide a forum and accountability and peer support. Clients are taught a language to communicate their condition and associated recovery process in their personal and professional lives. Immersion's treatment is designed to challenge our clients' comfort level established through their active addictions and core belief system. Our team has a very direct approach with clients about their addictions, associated behaviors, and the recovery process. Many of these issues have been tiptoed around or outright avoided by friends and family. Direct communication can ruffle a few feathers, creating discomfort, emotional disturbance, and resistance. Experiencing these unpleasant feelings in a therapeutic environment is an opportunity to grow and to change. A client's behavior when disturbed allows us to better assess and treat the barriers to recovery. Establishing trust and rapport is key to challenging a client. If we do not have either, this approach will be unsuccessful. Our staff considers client resistance as an opportunity to be helpful. A new skill set is taught and developed to manage anger, fear, and anxiety. We are compassionate and understanding with clients requiring a softer approach. Group therapy is a massive part of this process. We see often clients have an inability to communicate how it is that they feel, what it is that they want, what it is that they need. We see clients develop an idea of security in all the wrong places. When we first meet a client, to ask them to simply just depend on us because you've been asked to is not very effective. Clients will begin to depend on us initially because their life probably depends on it. They'll continue to depend on us because they see what happens and they begin to get results. What we hope to see after ongoing sort of dependence on a new set of ideas and a new healthy recovery lifestyle is that they continue to do it because it just becomes a part of who they are. We see that happen through a client's treatment plan, is that I initially have to engage because my life is on the line. I then continue to engage once I receive some results, and then I stay engaged because this is just a part of who I've become, and a recovery lifestyle has entered into my life and has proven to show me how to do things that I've never been able to do on my own. Family and key support involvement. Addiction is a family disease. We have never seen a successful treatment episode where the family system has been ignored, evaded, or improperly addressed. Our client's behavior has a lasting impact on the family system, leaving no one unscathed and unaffected by addiction. Arriving at an appropriate, healthy relationship with an addicted person is a challenging task. Family healing often requires substantial effort and significant attention to a family program of recovery. Our initial work with the family is identifying unhealthy communication styles, what has proliferated the existing family system, and educating the family on substance use disorders. We examine the past and look at the present for patterns and lessons. A family is encouraged to acknowledge the deficiencies in the family system and not in the individual family members. Families are asked to confront broken beliefs, unhealthy contracts, roles, and enabling mechanisms. This proves difficult as families often remain invested in untruths perpetrated by the addiction. Our clients' families are then educated on the clinical philosophy and asked to quote-unquote buy in. Family members are asked to seek out and participate in individual therapy, attend 12-step support groups, and to communicate weekly with our therapists. Additionally, we ask that families participate in our family workshop to set the foundation for the work that must follow as their loved ones is receiving treatment at Immersion. Our workshops provide an opportunity for our clients' families to gather together, share their experience, build new interpersonal skills, and develop important insights that will help them successfully navigate life with their loved one during treatment and after. Once a family has a solid foundation of understanding and purpose, they are able to develop the tools necessary to move through the recovery process. The family transition from being in crisis to healthy, alive family with an appropriate boundaries amongst one another. Family members will learn their role in the family and how this role affects others. Individual members will be able to identify how they contribute to a toxic family dynamic and learn how to be different. Clients and their loved ones leave Immersion with a plan of success for the entire family. Our goal is bringing the family back together. Addiction is a family disease, and our program will identify solutions needed to recover. A happy, thriving family life is attainable. I'm going to use this idea of secondhand addiction, right? Which I've learned about. And secondhand addiction is very similar to secondhand smoke, where although my son is maybe not smoking in my car, he could potentially feel the effects of me smoking in my car. Family members, we believe, experience the secondhand addiction, where they may or may not actually engage in substance use or alcohol use, but they definitely feel the effects of their loved one doing so. The family system at large is, and probably might always be, insufficient to overcome alcoholism without support and without help. What we look to do initially with the family is the exact same thing we look to do initially with clients. Outside of getting to know them, help them understand from our experience, these aren't assumptions, this is just from our experience, how we see these disordered behaviors and all of these destructive ideas influence and affect not only the loved one's opportunity to get sober, but the family system and the ability to communicate and live together. Mental health and personality disorders and medication. Mental health and personality disorders must be treated simultaneously with a substance use disorder. Immersion's immediate goal is to arrive at stability sufficient to make an accurate diagnosis. Part of this process is ruling out previous diagnoses. Arriving at homeostasis in brain chemistry is a part of a diagnostic process. This is often accomplished by, simply put, time away from mind and mood altering substances. Addictive persons are a very difficult population to diagnose, as long-term drug and alcohol abuse can often present as mental health disorders. Clients with mental health disorders have masked and treated their condition with their substance abuse and associated compulsive behaviors. We expect a client in early recovery to be anxious and depressed. This does not mean that the client has a disorder requiring medication. There are clients, however, that in their condition is not treated with medication cannot achieve sobriety. Immersion does not support the use of the long-term use of benzodiazepines, buprenorphine, methadone, or certain prescription sleep and pain management medications. We make no statement on the efficacy of these medications and do not wish to take a position on their place in the treatment of individuals with addiction. We believe that many of the widely prescribed medications in substance abuse treatment can be candidates for abuse. In regards to clients' individual mental health diagnoses or treatment, I'm going to say a statement that I believe applies to the demographic and the diversity of our clients that we treat. is that all clients fight in different battles, but they lose the same war. Each client brings a very unique, a very personal, a very fragile situation to the line here. At Immersion, we need to understand that not every single client is the same. They move through different family systems. They engage in different sorts of relationships. They find freedom and satisfaction in all sorts of different places. The war that everybody lost is, simply put, if I could have fixed it on my own, I probably would have, and I probably would have never needed to end up here. That we characterize as the war that we might have all lost. That doesn't make us all the same. Clients are tasked to engage in relationships with our medical providers who specialize in psychiatry. And we believe that in conjunction with the medical providers and our treatment and our clinical team, we think that the hybrid of those two things, between talk therapy and potential med management if necessary, is the most successful approach. Trauma. Trauma is an experience or series of experiences that create a belief system in an individual that the world is not a safe place for themselves or others. Trauma can present a psychological and physiological impediment to engagement in the treatment process. Our clinical team addresses the immediate presentation of symptoms related to trauma. Environmental triggers are often identified, and we work with the client to develop practical coping mechanisms. Understanding how trauma is a catalyst to the relapse process is a key part of the work performed at Immersion. A specific treatment plan for each client is created based on his or her clinical presentation of trauma. Any sort of chaotic or catastrophic event that has been unplanned or couldn't have been foreseen, we're going to call trauma at this point, which lead me to believe that dependence is no longer safe. We see trauma in death in the family, physical, sexual, verbal abuse. Each of these are assessed, gauged, and clients receive the attention necessary based on their commitment level to sobriety, what we feel to be a comfortable level of trauma treatment. Trauma is a huge leading contributor to addiction and alcoholism. Virtually all clients experience some sort of events or some sort of effect of relationships or anything that they've engaged in the past, which lead them to feel different. Those events could not have been planned, could not have been signed up for, and we acknowledge them and we treat them. Life skills and case management. Establishing purpose and direction outside of a recovery program is primary objective of Immersion. We have successfully treated clients ranging from executives and high-profile individuals to seniors tackling decades of addiction and young adults functioning at an adolescent level. We examine that this is necessary for a client to succeed over and above the adoption of a practical recovery program. Some clients don't know how to perform or lack motivation to complete simple tasks necessary for daily independent living. Others require medical, legal, and educational and professional resources during and after treatment. All clients must re-enter into a stable living environment as they transition out of the Immersion programming. A treatment plan is established to address these deficiencies. Ancillary case management services are available for clients with particularly challenging presentations. Clients come into our treatment center, we understand there's a massive world and potential issues and future successes that are going on outside of our treatment center day in and day out. As clients re-enter into society, we take special note as to what it is that they are going to be presented with, whether it be financial pressure, employment opportunity, getting back into college, failed relationships, failed marriages, child support, re-entering as a parent, whatever the case might be. we understand that if a client isn't armed with enough resources, with enough facts, and with enough support to maintain the outside obligations, that they won't be able to take priority while receiving our treatment on the outpatient basis. So we look to and aim to provide clients with enough support through case management to be able to maintain the responsibilities that will inevitably arise while clients are out in society. All clients require structured, ongoing care following discharge from residential and partial hospitalization phase of our programming. Historically, most addicts will make dramatic improvements in a residential treatment setting, yet find themselves back in crisis shortly after. Discharge plans are frequently insufficient to provide meaningful accountability and care necessary for continued sobriety after residential treatment episode. Long-term recovery from drugs or alcohol addiction requires a comprehensive life change and a daily design for living. We have specific treatment modalities with well-developed lower levels of care. Our extended care and outpatient programming incorporates a multifaceted approach to address all the challenges inherent in entering independent living after residential treatment. If a client is absolutely unable to participate in our extended care, we create a discharge plan closely resembling all of the features of our lower levels of care. After clients have moved through our first and second phase of treatment, we are always going to recommend continued care. There has to be some sort of monitoring to test the work that they've done while in inpatient treatment. What we learn about clients in outpatient treatment is far different than what we learn about clients in inpatient treatment. Clients get a chance to expose themselves to us, and we get a chance to see and learn about clients' daily routines when not given the structure of inpatient treatment. If clients are unable to participate in our 3-month aftercare program, then what we aim to do is create an opportunity for them to receive that same support wherever they can. For example, if a client needs to go back to its state, if they're not living in Florida, or if they're living somewhere else at the time, or this particular program is just not going to work for them, we are going to do everything as a treatment team to provide ongoing support and recommendation for continued care. Each one of our treatment steps builds and prepares for the next one. We understand that if we have a client who is committed on the work that they are doing in phase 2, then they are preparing for the work that they are going to do in phase 3. Each step builds off the last and prepares for the next. We always send clients through our phases and through our continuum with continued care plans. This is the clinical philosophy of Immersion Recovery Center. I hope I did a decent job at just on a broad level, going through each sort of facet. Thanks.
Hi, I'm Barrett. I am a primary therapist here at Immersion Recovery Center, Guardian Recovery Network. It's an honor to be here with you. I am here today to talk about CBT and the 12 steps an effective model of integration. An effective model of integration essentially means that we are working from the platform of both CBT and the 12 steps coinciding together. Oftentimes in treatment or in solution seeking, we might have one or the other available to us. We here are working under the model that more resources are better than just one, more support is better than just one, more models are better than just one. So CBT and the 12 steps very much complement each other. They are both research-based methods. CBT means cognitive behavioral therapy, and the 12 steps are essentially 12 spiritual principles, steps of action that take us into a path of recovery. So cognitive behavioral therapy and the 12 steps are both used as effective models to recover from drug addiction and alcohol use. They are also incorporated to address other co-occurring disorders, other addictions and have been proven throughout time to be useful and beneficial to people and to provide hope. So when I was thinking about this presentation, I was thinking about what CBT and the 12 steps really had in common. And hope was a big word that came up. A lot of times in addiction, in alcohol use, and in other addictions, we are finding ourselves hopeless. We are finding ourselves isolated. We are finding ourselves without a solution. CBT and the 12 steps come together to provide support and relationship. They break isolation through, in CBT, you have therapeutic support and rapport. In the 12 steps, you have socialization and community. So both CBT and the 12 steps share a deep dive into one's psyche. And what I mean by that is both cognitive behavioral therapy and the 12 steps provide practical tools of application with support so that we can begin to examine ourselves, examine what is, as 12-step literature will say, what is blocking us. So these can be negative thoughts, negative feelings, distressful feelings, our perception of negative experiences that have happened in ourselves that have also accumulated over time. So both CBT and the 12 steps dive into our psyche. They both also pose the idea that we can change, that our brains are malleable, that our perceptions can change, that our relationships can change. And oftentimes when we are faced with drug addiction or alcoholism, we are without the belief that we can change. Sometimes even the people around us or society around us loses the belief that we can change as well. Cognitive behavioral therapy, CBT interpreted. Cognitive behavioral therapy is essentially what it says right in the heading. It's based off of cognitive and behavior. That's how it started. So it launched in the 1950s, really, and then it became more developed in the 1970s. So in the 1970s, the emphasis was on our cognition and our thoughts influence our behavior. So what we think is an indicator of how we will show up and behave in the world. And if we can just begin to work with people on their thinking and on their thought process, then maybe we can encourage them to show up differently in the world in a more adaptive, helpful, healthy way. So since the 1950s and 1970s, cognitive behavioral therapy has expanded. Now it is more of an umbrella term for a bunch of different modalities and therapies that are underneath it. It also has expanded to include, well, how I think impacts the way I feel, which also impacts how my body responds, which also impacts my behavior, which also impacts the consequences that I see in the world. So that is kind of a broader view of what is called the ABC of cognitive behavioral therapy. It is a great quote is the fundamental assumption guiding cognitive therapy is that the individual's interpretation of an event determines how they feel and behave. So Dr. Robert Leahy, who is a renowned cognitive behavioral therapist, said that quote. So it's not necessarily what has happened to me, it is what I believe about what has happened to me that creates my circumstances and my reality. So that being said, that is not to be taken that, well, if my circumstances are really hard and I went through something really hard in my life, that if I just changed my thinking around it, then those circumstances wouldn't have happened. Then I can shift my reality. The idea is that we form belief systems based on our circumstances. So something happens that's negative in our environment, something happens that we don't like or we don't feel good about, or that produces feelings like shame or negative feelings, and then we have an internalized belief system that might say, well, this happened to me, and therefore I'm bad. Or this happened to me, and therefore I'm not good enough. This happened to me, and therefore I'm unlovable. This happened to me, and therefore I don't think I will ever succeed again. Cognitive behavioral therapy steps in and says, well, let's look at the evidence that you're using to support that belief system. So it's we can also carry that through in our life. So something happens to us when we're young, we form this belief system, and then it's reoccurring throughout time. So that's where kind of the dissecting comes in with support to look at those belief systems. So this next piece, we are going to go to the wheel. So what is on our PowerPoint right now is that if I change my thought, then I can change my feelings. If I change my feelings, then maybe I can change my physiological state. If I change my physiological state, then maybe my behavior will be different, and then possibly the consequences of my reality of how my environment is interacting with me and how I am interacting with my environment may shift and change. I think something important to be said when we're talking about both CBT and the 12 steps is that oftentimes we are coming into treatment, we are coming in seeking help in any form, whether it be through a 12-step model or through a therapeutic relationship, where we want our circumstances to change. Oftentimes our lives are in shambles, our relationships are in shambles, or we are just barely hanging on. And through this process, undoubtedly, I have had the honor of witnessing people's circumstances change. I have had the honor of watching people's lives heal, both inwardly and outwardly. Families heal, dreams come true. But what CBT and the 12 steps also focuses on is that even if your circumstances of your environment do not change, there is still the possibility and the potential to have some degree of inward peace. And time and time again, in my experience, when I am sitting with people and asking, what do you want, right? So on the outer shell, maybe they want a nice car. Maybe they want their marriage repaired. Maybe they want their relationship with their children repaired, or something to shift in their career, or to be seen a certain way in the world. And if we go to this deeper level, oftentimes the answer that comes back is, well, I want to feel peaceful within myself. I think a lot of people in the world, not just people who might struggle with addiction, are also faced with this, well, everything can be okay around me, right? What if everything is functional and somehow I still don't feel okay? Somehow I'm still using. Somehow I'm still drinking. So this is working from the CBT cycle, is working along with a 12-step cycle, which looks at mind, body, and spirit. Okay, so if we go to the wheel of CBT, this is my absolute favorite part of cognitive behavioral therapy. So this wheel looks at the situation, so this is an event occurring, the thoughts that I have in correlation to the event, the physical feelings that come up, my physiological response, my emotions, and then the behaviors and the actions that I take based off of this experience that I'm having. So maybe, perhaps, in the old model, the target would be that I'm looking at my thoughts and my actions, right? There's a saying that can float around a 12-step program, which is that I act my way into better thinking. So acting my way into better thinking is actually from CBT, essentially. That means that if I show up and I make my bed, maybe I'll start to think more highly of myself. If I begin to show up in my relationships, maybe I will start to challenge the thought that I am inadequate or not lovable. This is also a process of empowerment, meaning that my wants or my thought process or even my level of motivation do not have to dictate my behaviors in the world. So it's a huge piece for us in terms of learning how to show up and how to function again, how to reintegrate into society as who we are, is that it's relieving almost. It doesn't matter if I don't want to do something. I can actually do it anyways, right? Another recovery saying is, do what you don't want to do. If you do not want to come to group, if you do not want to show up for that phone call, if you do not want to brush your teeth, try to focus on the practice of building those behaviors with momentum, and eventually that will become a part of your habit and your routine. And eventually it might change your thinking. One day, the thing that you didn't want to do, you very well might want to do. So that is kind of the cognitive behavioral part. The other piece, and what is close to my heart about this wheel, is that we can have interventions on absolutely any point of this wheel. So yes, I can change my thinking, right? I can use tools to say, well, that person just looked at me strange in the grocery store. And my interpretation of that, my perception of that can be, they must not like me. They must be judging me. So I can also start to learn how to check my reality and say, well, maybe it's not about that person not liking me, and maybe it's not about me at all. Maybe it's actually about them, and maybe actually that's just them being them, and maybe I'm having that because I'm anxious today. So we start to kind of check our reality in that way, right? That's an intervention at the thought level. An intervention at the physiological level, these physical feelings that I'm having in my body when I start to gain the awareness of, oh man, waking up in the morning and thinking that I'm not good enough really puts me into a state of anxiety, right? Coming into this presentation today with you all, I can have the thought of, oh man, I don't know if I'm good enough. I don't know if people are gonna like what I say. That creates a physiological state in my body of anxiety and of tension. It's sending a message to my body, essentially, that we need to be producing a lot of chemicals to put myself into overdrive because I'm not safe in my environment and it's not okay. I can intervene on a physiological level with that anxiety. I can shake my hands. So if you're watching right now, you can start to shake your hands. You can clap. You can do very strange things that might feel goofy. You can let something go physiologically in your body. You can do jumping jacks. You can shake in your nervous system. And these interventions on each level in CBT will say, yes, if I do those things, this has the potential to shift my thinking, my emotional state, and then my behavior. It might make it easier for me to show up in the world. This is also where relaxation techniques come in, mindfulness, grounding. On an emotional level, right? Well, okay, if I'm sad and I'm tense and I'm pent up, maybe I actually need to cry. And that's another place that we can intervene. What is needed on the emotional level? Do I need to discharge emotions that I've been internalizing? Do I need to sit with emotions that I've been externalizing? And then again, like we talked about the actions, I can show up anyways. And maybe the more that I show up, I start to prove to myself that I can do these things. So this is becomes a platform, right? In 12-step language, we have something called the design for living. Again, this can be a practical design, a practical way, and very practical tools that we can begin to utilize on a daily basis to essentially shift who we are and shift how we experience ourselves, other people, and the world. Switch slides. So shifting my perception of myself, my relationship to other people and the world is something that the 12 steps can refer to as what is called a psychic change. So the 12 steps and this description of the 12 steps comes from AA.org. The 12 steps are spiritual in nature. The 12 steps do not hold any bars about announcing itself as we are a spiritual program. And that's, in a conversation or in a dialogue, maybe where the biggest difference is shown in this kind of cognitive behavioral therapy from this like Western therapeutic standpoint between the 12 steps, which will talk about God, which will talk about prayer and meditation. Which will say, actually, in order to recover from this hopeless state of mind and body, you are going to need to connect to a power greater than yourself. That you will need to have a psychic change in order to overcome this inability to stop using substances, right? This emptiness and this void that you experience, and this restless, irritable, and discontent state of being that maybe you've had no matter what your circumstances are. So when we're talking about the 12 steps versus CBT, a question that comes up for me is, well, what is spirituality? How is spirituality defined? Is CBT spiritual? In its nature, if I am focused on showing up in a way for other people and for myself and for the world at large in an adaptive, symbiotic way, isn't that spiritual in its nature? The biggest hang-up in the 12 steps sometimes for people is that God is presented with a capital G. And to that, the encouragement is, well, this is actually how you define a relationship to a higher power, and that you are taken through that process never alone, always with another person, with community, with support. So the 12 steps were officially published in 1939, and they were originally published through Alcoholics Anonymous. Since then, they have been adopted by many different programs and used and utilized for many different addictions, including Al-Anon, which is a program available for the friends and family of people who struggle with addiction. So one of the core pieces of the 12 steps is, again, coinciding to this idea of relationship, to alliance. The 12 steps were formed as a solution and kind of conjured up in this dialogue between one person who had recovered from alcoholism and who went and sat with a friend who was still suffering with alcoholism. And through this process of dialogue and at times debate, this full spectrum of the 12 steps was birthed. So that is just my my rendition of how that was created. But I think it's a very key piece because what we are focusing in on in the start of the 12 steps is that this is not done alone. This is not done based on self-knowledge. This is not done based on having information and facts and really even insight. into myself, into my pain or my fears. This is done with a constant mirror and somebody also sitting in front of us and saying, me too. Yes, I have felt that way too. Yes, I have that experience as well. Yes, when I put alcohol or drugs into my body, I have the experience of the same thing happening, which is that I cannot control myself and I cannot control how much I take. And everyone comes to that experience from different paths. But for the most part, what we find to be incredibly powerful in these groups, so in 12-step groups, in therapy groups, is that there is a common thread. That this barrier of isolation or this belief system that I am alone in my experience is broken down, that we become connected. And from a neuroscience standpoint, connection in our brains is actually the number one protective factor from addiction. It stimulates into our reward system the same social feedbacks and positive hormones and dopamine that we need in order to feel okay. Yeah. So steps 1 through 3, and I'm not going to go through an entire breakdown of the 12 steps, but steps 1 through 3, we have this kind of internal reflection process. We also have the examination of belief systems. We have the decision to take a different path in life, to take new action. In steps 4 through 8, we carry through with that action and that decision into reflection. In steps 9 through 12, we're essentially going out into society, into these relationships, and we are bringing the work that we have done and that we have gained from into the lives of others. This is also where we get into purpose, into having a greater purpose in the world. So this process is similar to CBT in the sense of this examination of internal belief systems and the decision that maybe I do not need to operate from these belief systems any longer. Maybe if I begin to adopt new belief systems and I trust the people around me that something else is possible, my circumstances will change, my outlook will change. Steps 4 through 8 are a rigorous internal process, again, of dissecting the psyche, going in and looking at what CBT calls cognitive distortions, what the 12 steps might call our inability to differentiate the true from the false. These resentments, these fears, this conduct that has been essentially blocking me from maybe who I know I am or who other people think I could be in the world or other people see me as, and I can begin to start to see myself as that. 9 through 12, again, is more action, and it's correlated to CBT in the sense of realizing that I impact my environment and that I am responsible to my environment and the people in it. And I am also responsible to myself in that environment. So something that feels key here is that once I start to have awareness and once I start to have these techniques and tools, I begin to have a choice. I sat with somebody once, actually I think it might have been in this room, and the topic of powerlessness came up. where it was almost a battle around this concept of being powerless, of walking around the world, without agency, saying I am powerless. So this is an opinion in many ways, but it's also something I've heard regarding both of these processes, that this is a process of empowerment. When we are speaking about powerlessness, which is in the first step of the 12 steps, there is a very clear indicator of powerlessness being related to, which, therapy and neuroscience backs up, that my body responds differently to alcohol and to drugs than a body that does not have the disease of alcoholism and drug addiction. Again, that circles back to when I metabolize a drug, or in my reward system, in my nucleus accumbens of my brain, there is a addiction reward pathway that has been dug, and I am past the point of being able to control what I use. That is powerlessness. That I am powerless over these very powerful substances, and I am powerless over this addiction and alcoholism that most likely, if we are at this point, has destroyed my life and the lives of those around me potentially. The rest of this path is about empowerment. It's empowerment in CBT, the empowerment that I can begin to have some choice in how I do feel, that I can begin to take some ownership through my actions, that I can actually challenge my own thinking through checking the evidence for the thoughts that I have. That I can change the state of how I feel in my body, that I can begin to work with anxiety and depression and fear and anger, that these are actually things that are not beyond my control. My world does not have to control me. The world might even begin to happen for me instead of to me. And the 12 steps coincide with that again, where it's, I have this awareness, I have a solution laid out for me, I have support around me, so I can begin to start to have new choices. So this is an example of ABC of CBT. Again, looking at an activating event that might happen, the belief that I have, and the consequences of that. If we look into the 4th step in the 12 steps, we might start to see some similarities of, question in a 4th step of, why am I angry? How did this affect me? And then what is my part in, essentially either carrying on that scenario, carrying on those belief systems, or how did I impact my own situation? Again, circling back to a process of empowerment, because once I can see that, I can change it with help. So both of these models come under the guise, if you will, of the idea that we can change our brains. Again, in 12-step language, this change of consciousness, this psychic change. In CBT, you might call it a shift, that I can shift my thoughts, I can shift my feelings, I can go from unhelpful thoughts to helpful thoughts. I can go from not showing up to showing up, or choosing how I do show up. But all of this floats back to I can change my perception, my consciousness, and I can change my behavior in the world. And this is where this idea of hope comes in. Our brains are malleable, 100%. They are flexible. So when we look at the science behind addiction, oftentimes we are encountered with hurt brains, brains that are in need of healing, neurotransmitters that are in need of healing, pain, hurt spirit, hurt body. And the idea behind the science of recovery is that there's hope that this changes. And it's been my greatest honor to witness, and see it firsthand in my life, these shifts and changes that occur for people. It is the driving force of continuing to be dedicated to this work. And something that feels important to say is that that is never just a one-way side of getting to witness a client or a patient or a group shift and change. That this is a relationship-based treatment where, either through the 12 steps, the person who is helping is oftentimes more helped. And through a therapeutic relationship, we are consistently growing and impacting and evolving together. So again, this work does not occur in a vacuum. And this piece of integrating these models of the 12 steps and CBT, right, a therapeutic, a 12-step based model, and medical professional aid comes from a wraparound model of as much support and resource and relationship as possible. And through that relationship, we begin to have the strength to learn these tools and begin to apply these tools. And as we learn relationship, both with ourselves, with others, that is where the true healing can occur. Yeah. So I think that I have said what I am meant to say in this time, in this presentation. I am incredibly grateful to be here. I am incredibly grateful for this experience. And I am grateful to be on such an exceptional team of people who continue to be committed to this work and continue to consistently help me to grow and to thrive. And again, this work is never done alone. So thank you so much. I hope that you got something from this today. I would love to hear back from you, and I'll talk to you later.
Again, appreciate your attendance, supporting our team, as well as supporting yourself by garnering as much information as you possibly can. Again, part of our main purpose is to make sure that we are putting something out in the therapeutic stream of this community. The community being international or just national, but our intent again is to offer something up to our community. We're going to talk a little bit about the culture of immersion. I had an opportunity to spend some time with a client of ours, someone who is coming up on a year sober. And as I was with this young man, I was thinking about this space that we're in. And I mean, specifically today, I was thinking about how I felt today. You know, what's been going on with me and what's been going on around here. Of course, there's been a bit of anxiety with those of us that are facilitating these workshops, I should say. But even in that anxiety, the camaraderie, the family feel, being supportive and supported by the peers. As I, again, thought about the culture of immersion, I thought how typical it is, how natural it appears to be to find that kind of camaraderie, to find that kind of spirit, to not have to solicit the support of my peers, and my appreciation for that, gratitude for that, and the fact that it seems as if it's something that just comes natural for that collection of people. And as I was sitting in session with this young man, this sign that was hanging on the wall caught my attention, and I wanted to share it with you because it kind of typifies exactly what we're going to be talking about. It says, "Our love or our lack of it will in the end be an expression of ourselves, of who we think we are, of what we want to be, of what we think we are here for." Thomas Merton. And for me, often I think about the circumstances that brought me to this place, the not so glamorous circumstances that led to me being in South Florida in the first place. I'm originally from Dallas, and 23, almost 24 years ago, found myself in need of some love and care myself. You know, suffering with my own addiction, my own challenges, and being encouraged by my mother to seek some help. And I remember being in a treatment program here in South Florida and not being sure whether or not this process would benefit me. Again, still participated, found some semblance of relief from my addiction, and there was this one night that I had moved on. I was living in a sober living housing, and I remember that this night pacing the floor, trying to find some relief from the anxieties that I was coping with at that particular time, not believing or not sure whether or not the program, the 12-step program of Alcoholics Anonymous, would benefit me. And so I'm pacing the floor. It's 3 o'clock in the morning, and I decide that I would try to get some kind of sleep. I mean, I had to go to work the following morning, so I lie back on my bed, and I remember having this overwhelming sense that the presence of my grandfather was in the room. And my grandfather had died in 1979. At this particular time, it was 1997. You know, so, I mean, it had been some time since my grandfather's death. But again, I felt his presence in the room. I felt that way that he used to hold space for me in the room. I felt that compassion, that love. I felt that will to give, to support. I felt that servanthood in the room. It was so palatable that I believed that if I opened my eyes, that I would see his physical body in the room. And so I remember I laid back and I considered myself cognitively sneaking up on him, and suddenly I just snapped my eyes open, again with believing that if I opened my eyes that he would be there. And unfortunately he wasn't standing there, but it was at that moment that I knew that I was going to be okay. And I often refer to that as my spiritual awakening. You know, we talk about a spiritual awakening in 12-step programming, we always say that that is just a shift in personality. It's a shift in our thinking, that I started to believe that that was a possibility that I could maintain sobriety. And so it was on that day that I found this sense of hope. And the reason I thought about that story as I was preparing for this topic is because I thought about what is the culture in this organization like? You know, what does that feeling remind me of? And the air in Immersion for me reminds me of that event. The air in Guardian Network, the connection between the people that I share this responsibility with. That connection reminds me of that night. It reminds me of an opportunity to connect with a spirit that I was sure would offer me some hope. So for me, that's the umbrella. That's the epitome of what a supportive culture looks like. And I think the Guardian Recovery Network is a supportive culture. But there are some aspects of organizational culture that I want to talk a little bit about. The way it's defined, it says that it's a unique, dominant pattern of shared beliefs, assumptions, values, and norms that shape socialization, symbols, language, and practices of a particular group. So again, it's a dominant pattern of shared beliefs. And so for me, it's important to understand what it is that we believe as an organization. And we'll talk a little bit about that in a minute, but it's important that we have this shared sense of belief and a shared sense of assumptions. But again, we'll talk about that in a second. Also, another one of the aspects of an organizational culture is the attitudes and approaches that I would say motivate us carrying out the tasks that we are responsible for carrying out. That there is a particular attitude that I get from the peers of mine that work in Guardian. One of the things that I used to say is that we have two disciplines that operate within the Guardian Recovery Network, specifically within Immersion. We have the clinicians that work in Immersion, and we have what we refer to as our 12-step contacts. And I used to say that they were our Navy SEALs and our Airborne Rangers. And they were both highly skilled in their respective disciplines, and they were also extremely proud of their abilities and their relationships with the clients that we had. And this is one of those instances where I felt that for someone to be proud was a positive trait. You know, for us to be clear about what our responsibilities are and feel that we had the ability to exercise those responsibilities. Again, I feel that that's a positive thing. So that's the attitude and approaches, which is also an aspect of a organizational culture. And also it says that one of the aspects is that culture is developed and transmitted by the people of that particular culture, both consciously and unconsciously, and it should transcend generations. And for that piece, the expectation that I have is that as the leaders and the clinicians and the support staff, is that we are actually passing on a legacy of hope to the people that we care for. Because what I would expect if I was going into a treatment center, if I was going into a hospital, if I was going into any helping institution, is that they would be transmitting whatever they felt was the cure for whatever ailed me. That when I left that institution, that I would carry that cure, that treatment with me through my daily activity. In other words, that my treatment would not be isolated to that building, that my ailment would find some relief in that building, but it would be something that I could share in my daily activity. So that culture is developed within this organization, but it is, again, transmitted to the people that we help, and it should be passed on to subsequent generations. Kenny talked a little bit about how we treat families, when talking about our clinical philosophy. And families, sometimes we often assume that what we're referring to are the parents and siblings of the clients that we work with. But there's also this aspect of treating the children of alcoholics, the people that contract the disease of addiction secondhand, that find themselves in a position of dependence just by way of being related to the people that we treat. So we expect that the hope that we transmit, that we use as a form of treatment, that the care, that the love that is a part of our organizational culture, that the family members, the children, the siblings, the parents, the cousins and brothers will also benefit from that part of our treatment process, our treatment programming, that they will benefit from that piece of our culture. One of the things that we must find first, before we start to even refer to something as a culture, that there are certain aspects that have to exist first. Obviously, it must be an idea, it must be a consciousness, a practice that's shared by the majority members of the group. So the hope that I refer to, the lack of judgment that I claim exists in the Immersion Recovery Center and Guardian Recovery Network, that idea has to be part of what our vast majority believes in, that they have to be vested in that idea, that they have to be vested in that philosophy, that lack of judgment towards the clients that we have, that willingness to support our clients no matter how many times they've been through our programming. And that's a claim that I can stand on, is that is an idea, a philosophy, a passion that's shared by all the people that are part of this organization, or at least the majority of the people that are a part of this generation. And it's obvious that it shapes our behavior. I remember talking to Kenny once about clients and our recidivism. And I asked the question, so how many times are we willing to treat a client? How many times do we think it takes for a client to grasp the program? At what point do we stop trying to work with a particular client? And I remember Kenny saying that we never give up. We never stop trying to treat the clients. So that's a part of our behavior. Part of our perception is that no one really knows, which time the client is actually going to grasp the program. I like looking at culture in the image of an iceberg, that on the top of the iceberg, the observable pieces of the iceberg are the practices that we have as an organization and the language that we use in that organization and the symbols that represent who we are in that organization. And underneath are the norms that we share, the behaviors that we believe in that are lying underneath, or the motivation behind those behaviors, or the values that we hold as an organization and also individually. That's something that I wanted to make sure that I noted, is that we're not only concentrating energies on our organizational values, but it is imperative that we are aware of the individuals that are working within that organization and what their values and norms are, as well as the assumptions that those individuals have, and that those assumptions are in line with that organization. And one of the ways that we monitor that, one of the ways that we police that, is through our screening process, is to see whether or not the people that we are interested in bringing into our organization if they share the same assumptions that we have, if they share the same views that we have, the same values that we have, the same thoughts and feelings that we have, if they still believe in the truths that we believe in, that we believe that our staff has the ability to behave as individuals and with a degree of autonomy, because we believe that our staff is spiritually driven. A part of our organizational culture is that we expect our clients, our staff, to be spiritually driven. We expect our clients to be treated with dignity and respect. I was looking at one of our corporate documents, and it had a saying on it that stood out to me, and it said that we play for the crest on the front of the jersey rather than the name on the back. I thought that had a great deal of impact on me. That as an organization, our expectation is that the people that are a part of that organization are about the team and not about themselves, which is beneficial when we think about the business that we're in. We think about the fact that our intent is to treat a vulnerable and hurting population, that we believe that the way that we do that is that we do that as a team, that we approach that all on the same page, driven by the same mission. So we play for the crest on the front of our jerseys rather than the name on the back. So values are those basic beliefs that an individual has that guides and motivates their behaviors and helps them to define what's right and wrong. So if we look at that, in developing an organizational culture or maintaining that culture, we need to know and to assess whether or not the people that we bring into the organization share the same values that we have. And again, the value is that we never give up on people, that we lack judgment, and we always encourage and try to instill hope in the people that we're responsible for treating. And norms are the rules that govern the behaviors of a group of people. So, what is the norm for that particular group? What are the behaviors? What is the language that is tolerated within that particular group? And I use that word tolerated on purpose, because I believe that as an organization that we have a responsibility to hold the people that are pieces of that team, that are members in that organization. We have a responsibility to hold those people accountable. So if we believe and hold true to the values that we have, when we see people that are stepping outside of those values, when we find people that are not believing the way that we believe, that are not encouraging or holding up the type of hope that we believe our clients need to be treated with, we have a responsibility to hold those people accountable. And so those are norms. And we have a specific symbol for Guardian Recovery Network. You can see it over my shoulder. We have a guardian angel as our symbol. And so I wanted to be absolutely sure as to what we meant by this angel, this guardian angel. And so the definition that caught my attention was that it was a celestial servant. And that is, it means something to me because of my faith, but as it relates to our organization, I think that it carries a great deal of meaning. Celestial meaning belonging to or relating to heaven or / hope, in my opinion, or a servant who is a person who performs duties for others. What better symbol to have in an organization like this? What better symbol to have than a guardian angel? Someone who is a purveyor of hope with the intent of serving other people. I think that is a perfect way to set the standard for behavior in an organization. that has the responsibility of treating and caring for people that, again, are a vulnerable population and that are in need of not just direction, but of people who have the humility to handle surrender. So a guardian angel, a celestial being. Another aspect of organizational culture is socialization, a process by which people learn the values and behaviors and how they adopt new members into that culture. So we have established this culture, this caring culture, this embracing culture, this group of people who love to take people in and to care for them as if they're their families. So we are also expected to train people that are coming in as to how to adopt that same system of values. We are supposed to be mentoring the people that are serving the clients that we have in our community, or the partners that we have in our community. So the Guardian Recovery Network, part of what we do is what we call onboarding. It's where we bring our new people in and we help to share that value with those people. We mentor them into whatever position they are expected to perform in. So again, there are some observable practices that we expect the people that are a part of our culture to participate in. We believe in a 12-step commitment. It doesn't necessarily mean that you have to be engaged in a 12-step process. It means that you have to be in line with the message of the 12-step program. And that message is the search and seeking of a power greater than themselves. We also expect a certain language. We expect our staff to be compassionate and empathetic with the clients that we have that may be challenged by mental health ailments or personality disorders or have trauma. We expect that they have a language that is soothing and caring. That is one of the observable practices. We also expect them to be comfortable with being a servant. We again, don't give up on clients. One of our norms. Our values are our commitment to integrity and our drive towards spiritual things. The assumptions that we have and expect both individually and to be shared is that we believe that there is a higher power. We don't ask that someone that comes into our organization necessarily adopt the higher power that some of us may have, but we do expect that they have a higher power and that there is no such thing as a hopeless client and that change is possible. So our cultural identity, the Immersion cultural identity is a place of hope, a place of encouragement, a place where clients' rights are respected, and a place where all newcomers are embraced. Thank you.